This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Are you tired of logging into multiple systems and duplicating your work? Managing your practice's payments can be complex and time-consuming. But it doesn't have to be. With Dr. Chrono, you can have access to our payments feature, which is fully integrated, so you save time and get paid faster. A game changer for medical practices. With Dr. Chrono Payments, you can process more payments, minimize administrative tasks, and streamline your workflows. Streamline the payment process and improve revenue streams in one unified platform. Visit drchrono.com/revenue-cycle-management today to see how Dr. Chrono Payments can transform your practice. Elation Health wants to support all those looking to start their own DPC practice. For that, they created a checklist for how to launch your own practice. Learn everything you need to know about planning to open a new DPC practice, from Medicare opt-out requirements to legal advice, financial support to marketing know-how, and the technology resources available to DPC physicians. With Elation's EHR, ensure your patients receive high-quality, proactive care through an intuitive clinical workflow while reducing manual work and charting time. Elation Health's EHR supports you throughout all stages of your DPC journey. Visit elationhealth.com/MyDPC Story to download today.
Hi, this is Dr. Krista Springston. Is the daily struggle of juggling patient care and paperwork burning you out? Have you been dreaming of starting a direct primary care practice? I was like you, and I attended a DPC Alliance Masterminds weekend where I gained the skills and confidence needed to start my DPC practice. And you can too. Join us for one of our 2024 Mastermind weekends. See a full list of events at dpcalliance.org/events.
Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Maryal Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. This is one of my favorite times of the year because even though I follow your guys' social media platforms, it's so cool to really just get some time to talk with you guys. And just for those people who are new to the podcast, please make sure that you listen to Dr. Mundkur, Dr. Mutch, and Dr. Hughes share their stories throughout the years. And this is the year 4 anniversary episode, which means you guys are going to be going into year 5. Time has just flashed by our eyes, and you guys are now truly seasoned DPC doctors.
Oh,
and so
God.
I didn't say old, just seasoned, right? It's like there's a
Heavily seasoned.
Yeah, I feel
Now I know how my patients do.
Heavily seasoned.
When I say,
Well, that's awesome. It's a gift. It really is. I listened to your guys' episodes in preparation for this one, and it's just, you guys, like, this is where you guys came from. It is so incredible. And so I want to start with these updates because things have changed at your guys' practice and your guys' lives, just like they did last year. What are some big milestones that your guys' practices have experienced throughout this 4th year of your practices?
So I recently hired Dr. Van Gundy last year. She is pretty much at capacity for her patient panel. And Dr. Diltz, we brought on, who's a pediatric headache and migraine specialist, and she also does medical acupuncture. And recently had her also add on as a resource for psychiatric help. So like getting kids diagnosed with ADHD, anxiety, depression, medical management of that. And yeah, and like at this point, like I'm going to essentially be stalling and I'll have to figure out what's next.
And then what's going on at Defiant DPC?
Yeah, so this has been a big year for us. So new baby Beckett. Well, he was very new. I guess he wasn't even born. Yeah, we were maybe just about to deliver when we last talked to you. So he's 10 months old now. He is full baby mode. Isla is toddler. So she's going to turn 3 in just a couple of weeks. And so definitely household feels full. It is wonderful. And we've really enjoyed having the chance to be able to watch them grow. Like that has been a huge, wonderful thing for us. We had like changes in personnel because one of our assistants graduated and went to medical school, but that also opened up a lot of things in the practice for like, how do we move around all the gears? And so we were looking at things like AI scribing for note generation, AVS generation. That has really been helpful because it allows our assistants to get out of the transcribing role in the exam room and then really double down on the outside of office coordination of care. And so that's been amazing. We've got one of them doing blood draws in the office. So that has been, it's a wonderful A team and it's been amazing. And then the other thing that we did was 4 years, we have not increased the price at all for our legacy members, the ones who came in. And this was we had like always had graduated prices and people would just come in at the new price. This was the first time that we had legacy members, we increased by $10. And I'm happy to go into it, but we didn't know what was going to turn out and things are worked out very well for us.
All right. So it's me. Well, I am one of those who kind of stays put. I just stay with my course of having a small panel. I don't have staff and I won't have a lot of updates on that front. But in terms of how my life has changed to a point where I'm never looking back from DPC, and this is it for the medical and clinical part of my life, is what I'm really happy to share. Because I feel like that was always the nervousness, because if I'm not growing from a staff standpoint or like the panel standpoint, I always wondered if it's going to last. But I guess with my MO being, I do what I do and this is what I offer, and whoever's wanting to join and is a good fit is welcome. I think it's really worked out exactly the way I expected it to. AI has made a huge difference in terms of note taking. I mean, really, it's not like I had a lot of notes to write with DPC in the first place, but I feel like it really made sure I didn't miss any points. And
how's the art stuff?
Yeah.
Well, you have to see my new art collection from Kauai.
Oh, man.
It's Kalalau Lookout. And so we've been traveling like we do. And it's been a very good experience travel-wise, family-wise. This morning, I had 5 different family members' reports that came to me and all, just knocking everyone's vitamin D levels and B12s and all that out of the way. But it really feels nice that I have time for the people I love the most. And I could walk my dogs this morning, which is crazy.
Yeah.
Who walks dogs in the morning at 10 a.m. or whatever, 9:30 a.m.?
Yeah.
So, and we built a new deck in the backyard. So in general, everything's working very well. Thank you, Maryal, for doing this. And I'm just amazed that we're at year 5.
Yeah, it's incredible. And I think that this is why I love opening with your guys' updates, because it's not the sterile, yes, like we have done these things clinically. I mean, we're going to talk about Lauren's amazing, insane 40,000 people on her Instagram. And Jake and Christina, you guys just went for a run in the woods. And it was like you guys were saying in your video how like you didn't really get to do this much for a long time. And especially now with kids, and you're doing it now. And then Deepti was like going to Costa Rica for 27 species of birds that they saw on an 8-day trip or something with her parents. Yeah. Oh my God. But I really love that you guys are still being you as you're going into year 5. And that's what I really want people to hear, just as an overall theme for this and all of your episodes, is like literally because you chose the path of direct primary care, you guys are able to be with your kids, to go to lunch with your kids, to do whatever you need. And so I think that is so refreshing. When I recently spoke to the medical students and residents at the state summit for California Academy of Family Practice, it was standing room only. It was amazing to know that there's other people who are listening to your stories and being inspired and choosing DPC because of it. And they're maintaining their lifestyle because of inspiration from you guys, right? So let me ask you there, because we are hearing, yes, updates in your practice, but also about your life. I want to talk about how you guys have learned lessons, whether it's increasing staff or whether it's just workflows, AI, all of these things, to really allow your practice to become even more efficient so you still maintain the ability to choose what you need to do for travel, for being with your family, et cetera. When you guys mentioned AI, definitely that's one thing that's a very hot topic. So Jake, could you start us off in terms of how you're using AI? And Deepti and Lauren, can you chime in as to what you guys have for efficiency at your practice, especially through tech?
Yeah, absolutely. So it has completely transformed our workflows. Before, it was very human assistant dependent, and that has basically the workflows, all of the protocols, you can kind of load that into the AI and say, okay, I want you to speak in, this is what my voice sounds like. I want you to speak this way. You can provide all those directions. I know everybody's got their different type of AI that they use, but basically I use it to generate the notes. I use it to, once the note is done, to take the note and make it into a quick AVS and send it to the patient. I use it for lab report analysis. Like, this is how I think about labs. These are the things that like are important. If you can just give me a rough draft of that and I'll make my appropriate edits, but it kind of knows how I do those things. Those are like the big heavy hitters, because it's something that takes a lot of care and a lot of time. You have to make sure that it's right. But at the same time, I tend to be a very like slow typer. And so this has really been a game changer so that I can spend all of my time working on that coordination of care. And now having assistants that are not immediately in the room doing that now, they can do way more coordination of care than they used to be able to. So that was nice, because some of that time was used to do blood draws and other things that patients really wanted as an offering. So it's kind of freed up a lot of time in a lot of different ways. Those are probably the biggest ways. Sometimes what I'll do is I'll like dictate a records. I'm going over this document, it was like 50 pages or something, and I'll just kind of dictate and then upload that transcript, then generates like a quick summary of what happened during that. And so I can just keep it and review when I'm seeing a patient the next time. And I've got that record of what the notes are. So it's been wonderful in that sense.
And Deepti and Lauren, how about you guys?
Yeah. So AI has definitely helped me with my notes for sure, but I also think it helped me with my health because my hands, I didn't realize that I guess through residency, you type a lot. Not that I typed a whole lot when I was back in India. It's just, I think the amount you end up typing when you're in training. And we never had Dragon and all those fancy gadgets. And so I started noticing that I had these tiny, whatever, ganglion cysts forming and stuff like that. So this year was a new ergonomic keyboard and a sit-stand desk and all the health-related upgrades for office. But at the same time, I think AI made it such a huge difference in terms of, I mean, you could dictate, but here we have this means of like literally creating a almost human-like experience in terms of the note. And I think that made a big difference. But I feel like it really actually helped my hands a whole lot more than I thought it would.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes. And Lauren, how about you?
So in peds, we don't have as deep in notes as you guys do. Our patients don't have a big history. So I know for today it was like fever times 4 days, maintaining hydration, Tmax 101, on exam, no acute distress, breathing comfortably, bilateral bulging tympanic membranes, AOM, RX and MOX, return precautions. That was my entire note.
So, and that's it's so important for people to hear that also, because I hear you and I totally get the difference between someone who's 72 and someone who is 2
Yeah.
in terms of their past medical history. But at the same time, that's your note in DPC. It's so that you know what happened. Someone else can check in on the note.
My patient can look. I'm covered legally.
Yes.
I'm done. It really doesn't. I think that was like the hardest thing initially for me, was to document less, because you're so used to note bloat from residency. And so how I use AI is I mainly use it as like the listening. It's integrated in our EHR, and it'll listen and record and then spit out our conversation as a note and an ABS. And the only time that I really use it, because like I said, my notes are typically really short, when I have a teenager coming in for psych or something like that. So I can actually sit and give them my undivided attention and focus exclusively on them without taking like something like that does require more detail. And that has been amazing, because it saves the recording. So if I want to go back and listen again and, should I have done something different? Like, it's there. And that has been pretty sweet. I also started using Phil Boucher's practice leads, and I'm getting ready to set every year I do a community vaccine clinic, and I do it manually where people email me. I email them back like all the information and the scheduling link, and then I manually put in scheduling information and manually check them in and all this stuff. So I've started using practice leads, which it integrates with my calendar, my EHR gives me like a phone number and stuff. And so it does just automation. So I'll just put a form up of, if you want to do the COVID vaccine clinic, Bloom, here you go. And it'll automatically upload pick them through to everything, schedule them. And I won't have to do it manually. At the end, it just spits out a data sheet for each day. And that is going to save me so much time. So that has been awesome.
And I just love that, again, you guys sharing what you're doing is also because you have the autonomy to do these things,
just to do it,
your tech. Yeah. I mean, Lauren, you've switched EMRs during this process. Jake is a go-to person for what's hot in the tech world. And the Deepti's functioning as a micro practitioner, still no staff. So you have the autonomy to do what works for you and to choose what works for you to help you get the job done. So Lauren, you've brought on, like you said, Dr. Dilts, and her panel is already full. Jake, you brought on Dr. Madala, your former co-resident, and Deepti, you are not with staff. So, but I think that, again, your different experiences are so valid. You're doing different specialties. You're doing things differently. When you guys think about either having staff or not having staff, because Lauren, you were even mentioning this, like it was really hard to let Dr. Dilts do her thing because you were like, I'm so used to doing it myself. How do you guys think about the experience of adding on 2 doctors at Bloom, one at Defiant, and Deepti, for you to continue to choose not to have a virtual assistant or staff? How do you guys think about staffing now that you are at year 4 going into year 5?
So I don't have staff. Those, Dr. Van Gundy is my primary care doc, and Dr. Delta is a headache doc. They're 1099 contractors. So I don't have staff. They run their clinic, theirs. And I mean, that was initially hard to let someone in. It's like getting a roommate after living alone, where it's like, hey, no, I put my eggs there or what. There is a little bit like, I realized that I had some control issues, but I still, like, when people ask me like, oh, why do you need a staff? And I think this is a lot of peds, because you guys get just labs left and right, and ain't nobody trying to stick a 6-month-old. So we just don't do a lot of procedures. And so my thing is like, what would I hire someone to do?
Same thing with me. I'm like, what work do I give them?
Yeah. I don't trust anyone enough to do anything.
I definitely don't have that problem. Let me tell you.
Okay,
there's plenty.
So Jake, this naturally makes me want to turn the mic over to you now, because with Lauren saying, what would I have them do? You have answered that question on your guys' own because you have multiple people working with you. And you sort of have this like feeder pipeline coming because your person went to med school and wow, look, they're back and they want to practice DPC because once you see it, you can't unsee it. So how do you address what would I assign them to do?
Yeah, absolutely. So the thought process is that one of the challenges that we had in the first couple of years is, again, we are so used to doing everything, right? And we want to be able to deliver this really high caliber of care. And that requires a lot of touch points. It requires a lot of coordination. And we can control what happens within our office walls, but a lot of healthcare comes within the gaps between that patient in the imaging facility, in the specialist office, all of that. And so one of the ways that we try to really distinguish ourselves and move the needle in our practice is by doubling down on the hospitality aspect. We were exploring that a little bit in the past couple of years, but we've really realized that is one of the things that our patients really value. And so oftentimes what we're doing is actively tracking when they go to see a specialist or something like that, or get an imaging, we're requesting those records. And if we don't hear from them, we have a task to follow up on those things. And so our assistants, their cell phone number is also something the patients get. And so if they have any questions, any concerns, then they are perfectly able to reach out and close those gaps. That way, we don't have a mammogram just going out into cyberspace because, oops, yes, the imaging company like just sent it to the wrong place. Even if I'm not liable for those things, I feel responsible when they happen. And so part of what we try to do is to make it as easy as possible for any hurdles in healthcare to be overcome. And that's why we have that extra team. So in terms of delegation, to your point, that is everything from reaching out to other facilities, that's specialist referrals, that's records requests, that's lab appointments, that's sometimes like putting in delegated lab orders. That could be a B12 injection if somebody needs it, all like the regular clinical stuff that people do. But it's also things where I know this needs to be done. If I had enough time to think about a protocol, I could create one, but we're getting more and more comfortable saying, you guys know our methods, our principles, what this practice stands for. Here's the task, and I trust that it's in great hands. You know what? They do a better job than I would in that sense, and they're really able to keep in touch with the patients as they're delivering, as the care is happening on the back end. Oh, how did that GI appointment go? What's happening here? And as their skills improve, then all of a sudden that could be hospital advocacy, that could be any touch point where somebody has a problem. Now what it is helping people, even though we don't deal with insurance in our practice, we want to make sure patients are getting the best possible things. And so as a result, we try to guide them through that. We know imaging prices, and we can help talk them through what the best options are. That ability to curate doesn't have to be just on the physician's shoulders. That is a teachable thing. And so as a result, it's something that you can arm your staff with that hospitality and with that knowledge, and then they can just take it and run with it.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad. I totally feel you. That is where I love that you've always used the word hospitality, but that is exactly what our patients are experiencing, all of our patients, when they experience like a personal relationship with our doctor. Now, Deepti, how about you? Because you have continued to choose, hey, I can actually do my traveling, do my Legos, do my pottery, and play pickleball, and also take care of my patients, and I do not need staff to do it. What has Have you reached the point of, could I have staff? I don't need staff. And what goes on in your head if you do have that conversation, looking at that branching point?
Yes, thank you, Maryal, for that question. I think I agree with Lauren on that control freak attitude. I mean, I don't come out as a freak. I obviously want to seem, Lauren doesn't
I
either.
do.
No,
No, I
come
do.
on.
Oh,
No.
girl.
But you know what I mean? I definitely I mean, this is a very nuanced topic, right? Because see, Jake, you found people you feel really comfortable with. There's some people who try. I know a sleep medicine doctor who's just started her practice and she had so much trouble with her staff. Like literally all my patients are reaching out to me about, hey, I don't know what I'm supposed to do next. What do I do with this? And then I reach out to the doc and she's really nice. She'll text me back. But this situation is such that she just she's making excuses because she doesn't know any other way of handling this. She's saying, yeah, my staff bad day and she had to. And so then when you make excuses, it doesn't come out the right way. When you want hospitality to be the experience for your patient should not be listening to excuses. Like it should be a super seamless, easy experience for them. So I feel like it probably is a touch point where I feel it's hard in San Diego to find the right kind of staff. Everything's expensive in San Diego. You got to pay a lot more. But I do feel like this, in the past 3 or 4 years, since I started DPC, obviously the first year was just trying to set everything up. But in the past 3 years, I do feel like I've made so many connections within the system with physicians, with physical therapists, with pharmacists, that I'm able to connect with them. For instance, yesterday, one of my patients who's got eczema in her ear canal, I'm trying to figure out what's going on now that she's having worse itching and there's some fluid. And so obviously I want to go examine her, but I don't do ear swabs. I just don't have the lab kind of set up with my practice. But the ENT doc who I see for myself is so kind enough that she is there for me if I reach out with any questions. What do I do if I see this? What do I do if I see? And then she's able to give appointments to my patients. I know the front desk person's name at that ENT office. So I tell my patients, ask for this person. So I'm literally doing what Jake is able to do through his staff. But luckily, I do have the time that I can dedicate to it without needing anyone else to do it for me. But I do know that reaching out to, if you're considering starting your own DPC practice, apart from marketing for your practice and all that, there's so much value in developing relationships. Send some donuts, send some yummy stuff to all these people who are working so hard and yet making time for you and responding to your text questions. Right now, a physical therapist is trying to call me because I have a patient who's had really bad experiences in the medical system where she felt really torture is a very hard word, but I do feel like it was really hard for her what happened. And I wanted him to really spend the time to be gentle and nice and kind, which he already is, but he even called me back to talk a little bit more about it. So I feel like the whole system is ready to help you if you reach out for help with or without an assistant. Yeah.
One of the things that I want to call out here is, Dipti, on your website, it says limited enrollment. Jake and Christina, you guys have Dr. Madala joining you. And then, Lauren, you have two doctors who are 1099s, and you stopped taking patients quite some time ago, minus their siblings of existing patients.
Right.
So when you guys have patients who are contacting your practices, how does it work? I ask this especially for those people who are like, oh my God, I'm at year 2. I'm going to be where all of you guys are in a few years. Like, how do I handle it if my panel is full and I need to still take care of my community?
For me, that was why I looked at it hiring Dr. Van Gundy. And because she is filling out, I'll be thinking about, well, should I bring on another doctor? But I feel good about, I still serve the community. I do this free clinic every fall. I do the services that I feel valued in, but I also have, it is not an individual issue. It's a systemic problem that there's not enough people. So I can't take care of everyone. Yeah. And it's not my job to take care of everyone. So I think we have a lot of this like martyrness in medicine. Yes. Of you have to sacrifice yourself because if you don't, who will? But my mental health is more important than
Yes.
than that. And so
Yeah.
I this is not my fault that there's not enough doctors. This is not my fault that the system is so broken. I am doing what I can in my corner, and that is the end of what I owe society. I do the free clinic because that feels good, but if it ever stops feeling good, I'll stop.
And that's so true, especially because we are all primary care physicians. Like that hits home for so many of us, whether you're in DPC or not. It's, I didn't create this shortage. I didn't create the system that treats primary care at the bottom of the barrel, especially your pediatrics. Look at you guys. I mean, it's like,
Yes, not fair.
And that's requiring fellowships for freaking hospitalists and urgent care and ER. And they are trying not to get people to go into pediatrics.
Yeah.
And that's not my fault.
Yeah. I think you make a great point. We know that we're not going to have the largest panels in the world. And in fact, like at some point, our quality and our mission for what we're trying to do would suffer if we did.
It would become the system.
It would be, yeah, exactly. And so how do we make sure that we're not complicit in creating the conditions we say we don't want? So we have things for the community that we do, the Walk with a Doc nonprofit program, where you can talk to a doctor and we can talk about health topics while we're doing a health activity, walking around the local community. But the biggest thing that we can do right now, if we want to grow, is to create the conditions that a physician would want to practice in. And talking to medical students, talking to residents about why this is something that is wonderful. And so, yeah, I definitely agree. There is I think primary care and in an extension DPC to some extent has this really challenging issue between being mission driven versus optimizing for martyrdom. There really needs to be a clear understanding that we're trying to serve people and that we have a vision and want to show people, whether it's patients or medical students or residents, what amazing care can feel like. And that's going to be different to each one of us. And just like a different restaurant or different car, like whatever it is, like we have a model for what it is we want to communicate. We have something to say about healthcare. And so if we're serious about that, and if we believe in it, then there has to be limits placed on that so that we can make sure we are doing the absolute best job. And that's something that I've become over the past couple of years, standing more and more behind.
and it's so you can hear that in all of your guys' interviews, in that you have been driven by what do I want to do, again, to allow this practice to serve my needs, but also the needs of my community, without going to this point of, oh my God, I've rebuilt the system and I am burned out to a crisp and I can't spend time with my family and do all the things. And we see it, thankfully, like we look at the data that was presented at the DPC Summit this summer, was that the AAFP membership identifying as DPC, and everyone who's in family medicine is not an AAFP member, but those who are identifying as DPC, it went from 4% to 9% in 1 year.
Wow.
I mean, there are so many people choosing DPC because we know as medical students that we went into this job as becoming a doctor to be able to be there for patients and to take care of them. There's no way in heck that you can do that when you're leaving medicine because you're burned out and you hate your job. You don't even want to go to work. I think definitely this is not DPC is not a form of martyrdom. It's a form of anti-martyrdom because we have to take care of ourselves to take care of other people. But also it is a way to literally, it's not going to fix it overnight, but we are saying, forget anybody else trying to fix the system. We're just going to do it ourselves. So Deepti, how about you in terms of your change of your verbiage on your website? It's a big neon pink banner. It says limited enrollment.
I think the limited enrollment kind of popped in around the time where it felt like the Venn diagram of my happiness, and kind of how Lauren and Jake have been talking about it, in my Venn diagram of my happiness, my ability to take care of my patients, the insurance drama, and what needs to be done, especially now with weight loss meds and diabetes meds. There's newer, really awesome meds. Like these are meds that can protect your kidneys and heart for such a long time, and my patients can't afford it because they're a truck driver without insurance, or such situations where you have to talk to a independent pharmacists, try and find the best prices, look at like Mark Cuban's drug cost company or whatever. You've got to look at all the different options you have to try and figure this out for your patient. I'll just give you one quick, really sweet example. So this patient was getting her Wegovy for the longest time. She's done really well, but she happened to go on vacation, just like I went on vacation to Costa Rica. And at the same time, she was supposed to receive that prescription via mail to her house, where obviously she isn't anymore because she's traveling somewhere else. And so the pharmacy was not letting her pick up that prescription anywhere else because insurance said, no, you already have something coming to your house. So how do you expect that patient to abandon their vacation, go to their home, which is probably like a 7-hour flight or whatever, to get that prescription and keep that medicine going? So I had to make a phone call to the insurance company. And as usual, when you call them, you're not getting anywhere, right? So I recorded the conversation. This is in Costa Rica. I recorded the conversation, the whole conversation where she just hung up on me, that person who, the insurance representative. She told me she would connect me to someone who would help, and then she just hung up. So I sent that recording to my patient. And I said, this is all I can do. You find out what you need me to do next, and I'll do it. Because the insurance companies make it look like we don't care and we don't do anything. And I think that is the reason for my limited enrollment. Like, I really think this is why the martyrdom part comes into play. It's not that I'm doing a lot of clinical work. There's a lot of nonsense that insurance companies bring in the picture, which is why I know I love DPC and I look, but the clinical care in the United States has to change. Like, this has to change tremendously, especially when there's new meds coming out and we need those meds covered for our patients. And so she actually literally texted me back saying, I'm having dinner with my family in Costa Rica. I get a message, don't worry about it. This is my patient saying, don't worry about it. I ripped out a little beep and they're sending me the prescription. 2 or 3 times in the past, when the patient really pushes and asks for it, it happens. But oftentimes they hesitate because they feel like the doctor needs to do something about it. They don't know how the system works. So they go, oh, my doctor needs to send something, so I can't push for this to happen. Now she had evidence that I called and they didn't do something that they were supposed to do. And so she got the prescription right away by yelling at them. So it's unfortunate that patients have to lose their blood pressure goes up when they have to yell at somebody. It's not good for their health. But the system is such that the limited enrollment is because I'm kind of pulled in some directions like this. And I know having a staff member might feel like this is going to solve it, but it's not, because I'm required to talk to these peer-to-peer review type stuff. Like I'm an assistant can't do anything beyond just letting me know that I need to talk to an insurance company. So I think that is just my experience so far. So I feel like DPC is great, yes, but there's so much that has to change with the healthcare system. And I really am very hopeful that it happens day by day.
And as you guys have grown and you've adjusted your panels to either take new patients or not, or to slow down the tap of how you take new patients, what has happened, especially over this past year, in terms of the in the clinic visit with the patient? What have you guys done at your practices, going back to that hospitality, to really create this holistic experience for a person that you can give another example of? I mean, last year, Christina was talking about how she went to a hematology oncology patient with a patient. I think it's helpful to hear that even when you're, year 4 going into year 5, you are still able to deliver this care. But through examples specifically, I think it helps people, especially who are exploring DPC, as like, what exactly is it? You can answer this through examples, just like Deepti did.
I have a good, but it was sad, but I think this is like a really good example. Dr. Van Gundy, we had a 2-year-old little girl Saturday that she was out with her family eating lunch and started getting really hysterical and crying. And they called Dr. Van Gundy, and while she was on the phone with this family, the baby stopped breathing. And so Dr. Van Gundy she was on speaker with them that the kid was having stridor, and she was like, run across to Price Chopper. I'm going to talk to the pharmacist. And then on their way over, they were nearby when the ambulance got there and got to the ER. So Dr. Van Gundy went to the ER and met this family. And unfortunately, this baby died. But Dr. Van Gundy was able to they were yelling for her. That is the relationship that we've cultivated, that you don't ever think about in your darkest moment, reaching for your doctor. And that's what they did. And I think that is like one of the most impactful things that we have done is create that it was able to, Dr. Van Gundy could sit and hold her while her parents got interviewed. And then she was able to talk to the ER doctor and get the medical information, the medical side of what happened. And so then she is able to, when parents are out of shock, talk to them and they can fully comprehend when they're ready what happened. And you can't do that anywhere else.
Yeah.
Just as a parent, it's so heartbreaking to hear that, but I totally get you. And the last person that you would expect to want to talk to is most times who you put the blame on not saving your child.
Yeah.
And I have seen that. I remember the blood curdling scream of the mom whose 5-year-old had died and from drowning. And she was so angry at why didn't she? And it's like to be able to just be there and not have to feel I'm so sorry. I have another patient who's dying in room 3 that I have to take care of. So you're crying. So sorry. I need to go. Like you don't have to feel like a piece of crap when you do those things because you don't have to do those things. You can, like you said, Lauren, I mean, basic, like you're at the park and you're like, dude, I can't get back to your text today. I'm going to get back to it later this evening when I'm done with the park. But you have the ability to literally pivot as you need to, as your patient's care comes up. Oh,
yeah. Like in DP, this is the only place where I can be like, oh yeah, like your eczema prescription can wait till I'm home.
Yep.
Versus, okay, this takes priority over my children right now. And thank God that is what happened, is a very rare and uncommon thing. But I feel like those tragedies are usually what gives the most power. And I feel like something like that is just you can't replicate that anywhere else.
Yes.
Yeah. Sorry to shit on the mood.
No,
it's so important though. It's important.
Yeah, and it really highlights one of the things that I spend so much time talking about protocols and this and that, but this is like the return of humanity to medicine.
Yeah.
And it is a wonderful thing. And we get so pissed off about it because it matters, right?
Yeah.
There's a reason that we're doing this, and to be able to actually execute on that to make that vision a reality, like that is huge. Like we're connecting dots for people. And that becomes part of the narrative of the story of their lives. So it matters.
It's just so powerful. And this is the type of stuff where it is really difficult sometimes you can say, yes, DPC is membership based, blah, 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 but to really understand DPC, you guys understand it so much differently. Even though you knew you were going to do DPC out of residency, you understand it so much differently because of all of these experiences that you have gone through to meet the goals of what you wanted to achieve in DPC. So it's so cool that to hear these things in that this exists. This is not, like we've talked about, in your years leading up to this, is not some voodoo medicine. It's like, in some fairy tale book. This is like legit. Your patients call, you know them, you're there for them when they need it. Yeah. So it's just, amazing.
So I think that I can think of a lot of examples here, and we've started trying to do a better job of explaining the value of care coordination to patients. It's a huge part of primary care. And it often, because it's somewhat intangible, I don't think it often weighs heavily in the recognition of what primary care can deliver on. And so we keep these examples. One of them I just had recently where this patient has like a breast cancer risk score, like super high. And we were like, okay, you're going to need a breast MRI. I know you're young and this isn't something that's typically done, but for you, it definitely makes sense. And there were some other factors in there. And so I placed the order, and then the patient texted me saying the radiologist rejects this order. They will not do this. I said, I disagree with this. And I just literally picked up the phone. I called the radiology tech and I said, this is why this is happening. This is why I think it needs to be done. And they said, yes. And let me call that patient immediately and we will get that fixed. And that's all it took. That time, it was just sitting on the phone for a little while and then kind of putting my weight into the decision. But that's something a patient cannot do by themselves. There are those times where you really need to have that stamp of approval that's saying, yeah, I didn't make this recommendation on accident. Like it needs to happen. And sometimes we tend to undervalue or underweight the power of that recommendation in our own minds. There was also another one where patient had a kind of a middle of the road gray concerning skin lesion. I said, you know what? This probably needs some extra attention. We know that dermatology this time of year is just absolutely filled. It's 3 months to get in with some of these people. And so rather than just say, okay, 3 months, like, see you later. I said, no. Like, I think this is a question that should be answered a lot sooner. And so I have a dermatoscope. I put my iPhone over it, took a picture with my dermatoscope and saw what the lesion looked like. I said, here, this is why I have a problem with this. Do you want me to just send this to, I know the foremost dermatology expert in the country, like let me just put in a direct consult and we can make that happen. They said, yeah, we had an answer back the next day. And so it does not need to be complicated. And we develop all these protocols to deal with a system that is inefficient. But if you are able to really roll up your sleeves a little bit and say, this is what needs to happen for this person, we're going to make it happen, then you can just, you can move mountains. And so that's one of the powers that DPC gives you. It's not just about tech-enabled efficiencies and that kind of stuff. It's I have the time to think and then solve the problem the best way possible.
I have a couple of examples, and I feel like a lot of this really helps upcoming budding doctors to really know what DPC is about. And it's not just the logistics of running a DPC, there's so much deeper meaning to DPC. So one is right now, as we speak, I have a patient with an ectopic pregnancy. We're hoping to save the tube over the course of these 2 weeks, right? And so if I was in a regular 3,000 panel practice, I wouldn't have been able to pay as much attention and follow up every day with the patient. So she has also been an excellent patient. I think we also tend to attract patients who care about themselves because they're wanting to pay that money membership fee, which is a small fee for such huge health benefits. And I think she was really good about it. She found out she's pregnant, but she is an Army veteran who easily has healthcare access, and she shouldn't need me if you look at the most ideal world scenario. But she's paying for me. And she was able to get HCGs done. We got the ultrasound done from Planned Parenthood. And initially, it was so early that we couldn't even see the ectopic, but we knew something was off because there's obviously nothing in the uterus. And so we kept doing the follow-ups, even though OB was not able to see her for a whole month or longer. So I was using other imaging centers to get this done because I'm not OB, but I have my patient who needs help. And it doesn't matter. I mean, we're going to think outside the box and get things done. So she got her methotrexate shot because thankfully we had an opportunity to avoid surgery and to save her tube. And this morning she messaged me that she would like to do 2 more HCG tests beyond what was ordered by OB. And I am totally for it. It is so hard to live in this waiting period of, oh my God, is this going to rupture or burst? And I need emergency surgery or could die because ectopic pregnancy is such an emergency when it really, when the HCG goes up and you could run into issues. So I've almost lost a really close friend when this happened. And I think it's so personal to me. And seeing that she as a patient and me as a doctor are able to have that kind of a bond where she feels comfortable reaching out, I'm like, here, there's no guidelines for how many times you need to check HCG. Honestly, I'm going to do it for you because I want you to sleep better at night so you can allow yourself to heal while this happens. And it's what, $6 for HCG quant, like it's fine. So I think that was one example I wanted to share. And I'm really hoping that the outcome is good because she just got her second dose of methotrexate. And also with everything going on in this country with reproductive rights and all of that, I feel all the more the importance of when someone's life is at stake. I think all of us are doing our bit, and it really makes a huge difference. So that's one thing I want to share. And there's one more, just because you give me this opportunity, Maryal, I want to share. There's a really awesome, highly accomplished director at the program who's my patient. He's had a liver transplant. And he's had complications post-transplant, and he has a stent replacement that needs to be done CBD stent. And every time he goes for the procedure, he comes back with like bacteremia, sepsis, septic shock, almost. He has a transplant team and a really reputable institution. But we have, for the past 2 or 3 times, aborted these septic shock events by me having a standby blood culture at the lab. So he can go in the moment he feels like tachycardic or sluggish post-procedure. And we've started empiric antibiotics right away, and we've prevented that. And it's crazy how in the ER, when so many patients there's overcrowding in the ER, he has had to have debates with staff about how his thermometer is right and their thermometer is wrong. And this is such a painful thing to even imagine. If my family were to have to experience, and imagine this patient with such patience, he's going there hoping that the ER will give him IV antibiotics for his sepsis, septic shock. But it's not one person's fault. It's a systemic issue where there's no time that ER docs and staff has to engage in excellent patient care because they're just overcrowded. So his blood cultures he's going on a vacation soon. So we've been able to save him. So being a micro practice, I'm only having that many patients, but sometimes I need to think of these good things that happen with my practice, this impact that I'm having on these few patients and few lives, that a lot of new budding doctors can also have a similar impact without me having to expand.
And you really highlight quantity over quality. Like when
Yes.
you have more doctors who are doing quality medicine,
Yes.
you have more prevention and less people playing the system of codes that where sick codes and hospitalizations are worth more than prevention. So it's just crazy. And it leads me to my next question, because you guys, absolutely, Deepti, you said that you guys are doing your part to take care of the community, but you guys are also very much active in helping our nation and the culture of our country understand that there is a different way. So can you guys talk about how you are, even beyond your practices, playing on social media, sharing posts that are important for people to be aware of, because you are also making an impact beyond the patients that you take care of on the day-to-day?
So, I mean, I started doing social media just as, hey, I have a practice. And then I started getting pissed at misinformation.
Yes, misinformation. I was just going to say that. Yes.
Yeah. So I wanted to be like, hey, okay, here's some factual evidence-based stuff. And it kind of slowly went on. And then I was like, what if I just talked like I talk? What if I talked like I talked to my patients and I talked to my friends and my family and just laid it out there like that? And it worked. And I think it's been great because I've been able to get people to know about direct primary care and what that means, what that looks like. People message me all the time, oh, we joined a DPC because we finally realized that our health is worth the investment and da da da. I think that's really cool. And then people message me that they've chosen to vaccinate because they listened to me, and that they also realized that they didn't need the antibiotics for the 12 hours of ear infection their kid had. And I guess not necessarily that they didn't need them, but that you didn't have to go into an urgent care immediately. So I think using that I try to use that as, hey, here's some ways you can stay home. Here's some ways you can not overcrowd the ER. Here's how you get a bead out of your kid's nose. Those sorts of things that I hope are helpful, but was initially just because I got so tired of misinformation. And your pediatrician doesn't know this because they went to Western medicine school and they weren't taught this. And so it's just been nice that people like science.
Yeah, health anxiety is a really big thing in our system when you can't even contact the person that you may trust, but in 6 months you could maybe see them or see the person who can quickly see you who
So I
doesn't
do
care
question
about you.
boxes all the time because of that. These people are like, is it okay that my 6-month-old rolls onto their belly? And you're probably going to have to make an appointment for that. And so I feel like I don't know, I'm trying.
Well, you're not trying. You're blowing it out of the water, dude.
Yeah,
I'm here behind the times. I'm like 40,000. You're like 117,000. That's And you know that every one of those people has friends on their social media and friends in their neighborhood.
Yeah.
And they're like, why are you doing that? You could just have a doctor like Dr. Hughes and Dr. Dilts and Dr. Mutch and Dr. Mundkur. Like, why are you doing that?
Yeah.
You don't have to. And you don't have to have a 7-figure salary to also have access to a doctor who has the time to take care of you and who really cares about you.
That was a really good point. You don't have to have a 7-figure salary. Like the big question you get in peds is, well, what about Medicaid? Yeah. Once again, not my fault. Medicaid doesn't reimburse well, but we have a ton of people on Medicaid. And you know what else? Because I own my practice, if I don't want to charge you the full price, I don't have to.
Yeah.
It's incredible, right? And so I think a lot of people feel that you're abandoning your lower income families. No, we're not. We didn't it's just, I think this kind of goes back to the martyrdom thing of I didn't drop reimbursement rates from Medicaid.
Yes.
I didn't not vote for a Medicaid expansion. Like that, I didn't do that, but I can do my part. And so I think that's the huge part is that like, I'll get a lot of people are like, I'm passionate about like indigenous health or something like that. And it's like, you can do those things. That's the coolest thing about this is you can make it whatever the hell you want.
Yeah.
You can do that. And I feel like that's so ingrained of looking at medicine through a microscope and you have a singular way to practice. And if you don't have a front desk, you don't have a biller and coder, and you don't have a nurse, and you don't have a blah, 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 that you can't practice good medicine. And no, like you literally do whatever you want.
Yes.
Okay, I'm done. Sorry.
You called it earlier. You said note bloat earlier. This is clinic bloat that you're addressing. Like none of that is needed when you are a streamlined practice. I mean, Dipti's going into year 5 and she is not at the point where she needs the biller, the coder, the referral specialist, the blah, 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 blah.
Yeah.
Blah, blah, blah. You definitely don't need the blah, blah. I really wish there were more Laurens in this world. I'm not even like exaggerating. This capacity of having a family of you kids, you have so much going on in your life and you're making time for social media where you're educating people like this sort of trust you're building where doctors and people who have spent their life understanding the science behind all these things are finally being heard because of you. That's huge. That's huge because I see so much misinformation, right? Like we are living in this world of social media where things you end up watching more is what's shown to you. And so when people watch your videos, they're obviously going to get more scientific backed, like educational videos. I mean, your impact is way more than what you're even imagining.
It's so important because I feel that it's much easier when you have a person who understands that when we don't have our autonomy, it affects our entire way of practicing. It affects our entire way of being human beings, being parents, being daughters, being everything. Because literally, when you don't have autonomy, you are thinking differently. You're receiving things differently. I mean, that's how I feel. I don't know if you guys agree with that, but it's as soon as my autonomy returned, like I told this to the medical students and residents that I spoke to, I have never felt more alive in my life because I only thought it was like, no, you go to residency and then you get an employed position and you get a 401k and then you die. Literally, that's what I thought happened. I just didn't understand that there's, oh my God, a different way. So it's crazy that what Dipti is saying is absolutely true, not only for the patients, but for doctors to be like, no, she's an actual doctor. She went to doctor school, has an MD, a lot of people didn't think I was an MD when I started. They thought I was calling myself doctor. And that was a huge hump that I had to get over. I promise I have the M and the D. I got both.
Wow. Well, when I don't wear scrubs and I'm a patient, I've been told that I Google too much by urgent care nurse. And so I wear scrubs all the time now, wherever I go, because somehow this is more legitimate than this.
Which is ridiculous is a light way of putting it. There's so many expletives I wish to say right now. But DPC allows people to not have to play into any system that they don't want to play in. You guys are doctors. You are trained physicians. You are not in this business to like, how many people can you see in a day? How many cattle can I run through the turnstile? Like, no. This is about, you guys have a level of training, and when you have the ability to deploy that training in a personal way, that is DPC. So Jake, how about you? Because you guys now are also, you're doing Walk with the Doc. What kind of impact have you seen because of your ability to be there, especially with your community, where they might not have an outlet to also, just like Lauren is the person that a lot of people turn to, your community might not have an outlet that they can spend time with, even though you might not even be their doctor.
Yeah, I think that one of the core things that is important to us is how do we further the reach and the footprint of our mission, even if not everybody wants to be or decides to be a member. And so doing the Walk with the Doc, that our nonprofit program, where basically we do a warm up with a local physical therapist or yoga instructor, kind of a rotating thing, and then we'll do like a 10-minute talk about any general health topic. This is basically at the town square for Williamsburg, and we just meet every fourth Saturday and we just talk about these health topics, and then we go on a 2-mile walk. And it gives a venue for people to ask questions about health and to hear our perspective on things that sometimes they can't get their own doctor to talk about, whether it's advanced cholesterol stuff, whether it's natural protocols for helping to fight off upper respiratory infections, especially as we're approaching October, teaching them OMT. We just did that, our last one, showing them kind of a sinus technique to help encourage drainage and just how that fits into medical care. It could be menopausal hormonal therapy, like all these things that people have questions about that, like Lauren was saying, that are saturated. The wellness space and all these things are saturated with misinformation. And so being able to clarify some of those misconceptions and give our standpoint on this goes a long way to rebuilding a lot of the trust that has been damaged between patients and the healthcare system, because you're showing them a counterexample. You're rebalancing that weight a little bit and saying, no, like this perception that people have of what doctors are and what they stand for, there's so much that's being left out. And so as I hear that there are more percentages of DPC physicians and people who are curious about DPC and thinking about that and entering primary care extension, I get really excited about that. I love talking to medical students about this because every instance that I can show them that there is a completely different way to give care is an opportunity to personally, in some small way, help address the primary care shortage.
Again, once you've seen DPC, you can't unsee it. Once you've heard about DPC, you can't unhear it. It has been insanely inspiring, again, to hear where you guys have come and really how you're able to share with the audience what DPC means to you, because you have been doing it for as long as you have. And I cannot wait to see what happens in the next year. We are going to be continuing the conversation over in our Patreon community podcast feed. We're going to be talking about, as we go forward, have you had thoughts about, is medicine always going to be my thing? So join us on our Patreon community podcast feed. And thank you guys so much for joining us today. Thank you for joining us for another episode of My DPC Story, highlighting the physician experience in the world of direct primary care. I hope you found today's conversation insightful and inspiring. If you want to dive deeper into the direct primary care movement, consider joining our My DPC Story Patreon community. Here, you'll have access to exclusive content, including more interview topics and much more. Don't forget to subscribe to My DPC Story on your podcast feed and follow us on social media as well. If you're able, I'd greatly appreciate if you could leave us a review. It helps others to find the podcast. Until next time, stay informed, stay healthy, and keep advocating for DPC. Read more about DPC news on the daily at dpcnews.com. Until next week, this is Maryal Concepcion.